CNA Pain Reporting Chain of Command. Welcome to the quiz. Question 1. You're assisting a resident to get dressed. They want to wear a brightly colored, mismatched outfit that does not go together. What should you do? Option A. Let them choose what they want to wear, respecting their right to make choices about their personal appearance and self-expression, even if it doesn't match. Option B. Tell them the outfit doesn't match and pick out something more coordinated for them. Option C. Go ask a family member what they prefer the resident to wear. Option D. Dress them in the facility's standard clothing to avoid this issue. The answer is A. Respecting resident choice and autonomy is paramount. Option A is correct because respecting resident choice and autonomy is paramount, even if the outfit is mismatched. Option B is incorrect because imposing your preference disregards their autonomy. Option C is incorrect because family may not know their preference. Option D is incorrect because facility clothing limits choice. Question 2. When providing denture care, what is the most important safety measure to take? Option A. Hold the dentures firmly over a sink filled with a few inches of water or lined with a soft towel to prevent breakage if they are accidentally dropped. Option B. Use very hot water to kill all germs and bacteria on the dentures. Option C. Brush them with a hard-bristled toothbrush and toothpaste to remove all debris. Option D. Soak them overnight in a plain cup of water, not in a labeled container. The answer is A. Preventing breakage is a key safety measure. Option A is correct because preventing breakage is a key safety measure. Option B is incorrect because hot water can warp dentures. Option C is incorrect because hard bristles can scratch. Option D is incorrect because soaking in a labeled container is important to avoid loss. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 3. A resident with a diagnosis of COPD is receiving oxygen at 2 liters per minute by a nasal cannula. During lunch, they remove their cannula to eat. What is the best way to handle this? Option A. Gently remind them why they need the oxygen and assist them in putting it back on after the meal. If they consistently remove it to eat, report this to the nurse, as a different delivery method, like a cannula that can be worn while eating, might be possible. Option B. Increase the oxygen flow rate to 4 liters per minute for the 30 minutes it's off to make up for the loss. Option C. Scold them for removing it, explaining that they need the oxygen. Option D. Let them eat without it, as it's only for a short period, and they will be fine. The answer is A. Educating and seeking solutions is the best approach. Option A is correct because it educates and seeks a solution. Option B is incorrect because increasing flow without order is dangerous. Option C is incorrect because scolding is not therapeutic. Option D is incorrect because they need oxygen continuously. Question 4. You're going off shift. Which of the following is the most important information to report to the oncoming nursing assistant during handoff report? Option A. That the resident had a small amount of bloody urine in their Foley catheter bag at 3 p.m., which was reported to the nurse, and the nurse is monitoring it. Also, the resident's sacral area is red and you applied barrier cream. Option B. That the resident's favorite TV show is on at 7 p.m. and they like the volume at 15. Option C. That the resident prefers their coffee with 1 sugar and no cream in the morning. Option D. That the resident's daughter visited and seemed very nice and friendly. The answer is A. Critical information requiring follow-up must be reported. Option A is correct because it includes critical information that requires follow-up, bloody urine, skin issue. Options B, C, D are preferences or non-critical. Question 5. A resident who is Muslim requires assistance with a bed bath. It is important to be aware that in many Islamic traditions, modesty is highly valued. What is a culturally sensitive practice? Option A, expose only the specific body part you are currently washing and keep the rest of the body covered with a bath blanket at all times. Ask if they would prefer a caregiver of the same gender. Option B, ensure the door is slightly ajar so you can hear if you are needed elsewhere, as privacy is less important than safety. Option C, ask a family member of the same gender to assist with or perform the bath. Option D, perform the bath as quickly as possible to minimize the time they are uncovered. The answer is A. Maintaining modesty and offering choice of caregiver gender respects cultural values. Option A is correct because it maintains modesty and offers choice of caregiver gender. Option B is incorrect because door ajar compromises privacy. Option C may be an option but not always feasible. Option D is not sufficient. Question 6. A resident who has had a hip replacement is being log-rolled for linen change. You notice the surgical incision is slightly red, warm, and has a small amount of foul-smelling drainage. What is your priority action? Option A. Complete the linen change quickly to minimize resident discomfort, then report the condition of the incision to the nurse immediately. Option B. Remove the dressing, clean the incision with sterile saline, and apply a new sterile dressing. Option C. Note the findings in your charting and continue with the linen change, covering the resident back up. Option D. Tell the resident that the incision looks like it's healing nicely and not to worry. The answer is A. Finish the task safely, then report signs of infection urgently. Option A is correct because you need to finish the task safely, then report urgently. Option B is incorrect because CNAs do not change dressings. Option C is incorrect because documenting alone is not enough, reporting is needed. Option D is incorrect because it dismisses signs of infection. Great job! Don't forget to subscribe. Bye!